Hello, everyone, and welcome to our monthly Health and Wellness Insight series. Each month, we bring you the latest and most practical industry trends and innovations in the world of supplements and functional health. If you're interested in exploring more health market insights, feel free to visit our information hub. And if you're looking for ODM or OEM partnership opportunities, we'd love to connect and collaborate on creating more valuable products and market breakthroughs. Now, let's join our two hosts and dive into this month's topic.
Okay, so you know that feeling like maybe it's the week or two before your period starts. And maybe a friend says something totally normal, but suddenly you feel incredibly sensitive.
Yeah, or maybe it's more physical for you.
Right.
Like just feeling a bit off.
Exactly. Or maybe serious bloating that just won't quit, or you're just not sleeping well.
Yeah, tossing and turning.
If any of that sounds familiar, well, you're definitely not alone. And it's probably what we call premenstrual syndrome, or PMS. Let's kind of unpack that today.
Let's do it. We're going to dive into what PMS actually is, look at some of the reasons why it happens, and importantly, focus on, practical ways to manage it based on what we know.
Right.
So if you're looking to get a clear handle on PMS, but maybe without all the really dense medical speak, this should be helpful.
Absolutely. And we've looked at some pretty interesting stuff. There's market research showing just how many people are actually seeking help for PMS.
Yeah, the numbers are quite something.
And also a really thorough article that breaks down the science and offers some, concrete advice.
So our mission, really, is to pull out the key things you need to know to navigate those symptoms a bit better. More understanding, maybe more control.
Okay, so let's start with the basics then. What exactly is PMS?
Well, fundamentally, it isn't just one thing. It's more like a collection of physical and emotional changes.
Okay.
And they tend to show up, somewhere in that 7 to 14-day window before your period actually begins.
And it's pretty wild how different it can look from person to person, right?
That's great.
Like our sources mentioned, one person might just feel their mood really dip over small things,
Yeah.
while someone else might be dealing with like actual physical stuff, dizziness, bloating, pain, swelling, even that poor sleep we mentioned that just tanks your whole next day.
Yeah, it really affects alertness, concentration. It's definitely more than just being a bit emotional, how it sometimes gets dismissed.
For sure. It really points to a need for like solutions that actually work for people, doesn't it? Suggests maybe the old approaches weren't quite hitting the mark.
Precisely. And just look at the market for PMS relief products. It really drives home how common this is.
What were those numbers again?
Get this, last year, 2023, it was valued over $21 billion.
Wow. Billion.
Yeah. And they're projecting it could hit over $37 billion by 2033.
That's huge growth.
It is. It shows the scale of the issue, but also, I think, this growing demand for, better, more user-focused solutions.
Right.
And what's also really interesting in that data is the shift towards natural options.
Oh, okay. Like what?
Like herbal remedies, vitamin supplements.
Yeah.
People seem increasingly interested in managing hormone balance that way, maybe being more health conscious overall.
That makes a lot of sense. So, okay, when all these symptoms are kicking in, what's actually happening in the body, biologically speaking?
So the main thing seems to be those natural hormonal shifts during the menstrual cycle. We're talking mostly about estrogen and progesterone levels going up and down.
Usual suspects.
Kind of. Although, interestingly, some research suggests it might not just be the level of the hormones, but maybe how fast they change, or even just how sensitive an individual is to those changes.
Okay.
But yeah, hormones aren't necessarily the whole picture. The sources also mentioned other potential factors.
Like?
Things like possible vitamin deficiencies or imbalances in neurotransmitters.
Neurotransmitters, those are the brain's chemical messengers.
Exactly. They let different parts of your brain talk to each other. And if those are out of whack, it can definitely affect your mood.
Gotcha. Now, the article we looked at also mentioned something called PMDD, premenstrual dysphoric disorder. How's that different from regular PMS?
Right, PMDD. It's basically considered a much more severe form of PMS.
More severe how?
The key difference is really the intensity of the psychological symptoms. We're talking really disruptive stuff, major mood swings, deep sadness or depressive feelings, significant anxiety, feeling extremely sensitive emotionally, maybe even crying spells quite often.
That sounds really tough.
It is. And there was actually a 2023 study mentioned that linked PMDD to things like more sudden drops in progesterone.
Okay.
And also potentially issues with something called the HPA axis.
HPA axis. That's related to stress, isn't it?
Yeah, think of it as your body's main stress response system. In PMDD, it seems like the system might get triggered more easily or maybe doesn't calm down as well afterwards. That could definitely contribute to those intense psychological symptoms.
Wow. Okay. That really puts it in perspective. But it's important to remember, right, that most people experiencing pre-period stuff are dealing with a more typical PMS.
Absolutely.
You know, the kind of with the more common physical discomforts and those sort of emotional ups and downs tied to the hormone changes.
Exactly. That's the far more common scenario. So yeah, let's talk about those typical PMS signs. What kind of things do people often report?
Well, the list can be pretty long, actually. Things like mood swings are common, feeling more irritable. Breast tenderness is a big one for many. That abdominal bloating we keep mentioning.
Yep, the bloat.
Sometimes intense cravings for certain foods, maybe even binge eating. Water retention, too.
Right, feeling puffy.
And then there's trouble sleeping, feeling really tired during the day, even if you think you slept okay, and sometimes just difficulty concentrating, like brain fog.
Yeah, that focus issue can be really frustrating. And these symptoms, they tend to really ramp up in the days right before the period starts.
Yeah, that seems to be the peak time.
Which, as we've said, can really mess with your daily life, your quality of life overall.
Definitely. Did the article mention who tends to experience PMS most often, like an age group?
It did. It seems to be most common in individuals between the ages of 20 and 40.
Okay, that's a pretty wide range. Are there things that make someone more likely to get PMS or maybe get it worse?
Yes, several factors seem to play a role. Family history is a significant one.
So if your mom or aunts had it?
You might be more likely to, yes.
Yeah.
Lifestyle is also huge. High stress levels, smoking, drinking alcohol, maybe not eating the most nutritious diet.
Yeah.
Those can all contribute.
Makes sense. What about hormonal stuff?
That too. Things like having irregular cycles, a history of pregnancy or miscarriage, even using hormonal birth control for some people can be factors.
Interesting.
And one more thing, having pre-existing mental health conditions like anxiety or depression might mean your PMS symptoms feel more severe.
Okay, that paints a clearer picture of the contributing factors. So we understand what it is, who gets it, why it might happen. Let's switch gears to what people really want to know. What can you actually do about it, especially the anxiety and irritability?
Right, the practical stuff. Well, diet is a really key area to look at. The article talked about something sometimes called a PMDD diet. But honestly, the ideas are good for managing general PMS too.
Like what kind of ideas?
Basically, cutting back on things like caffeine, lots of sugar, and too much salt.
The usual suspects for feeling kind of crummy anyway.
Pretty much. And on the flip side, upping your intake of fiber-think fruits, veggies, whole grains, and complex carbohydrates, those can help stabilize your blood sugar.
Avoiding those energy crashes and mood swings.
Exactly. Stable blood sugar often means a more stable mood.
Gotcha. Any specific nutrients that are particularly helpful? Supplements, maybe?
Yes, the sources mentioned a couple. Calcium and magnesium are often brought up. They might help with things like muscle cramps and also potentially ease feelings of anxiety.
Okay, calcium and magnesium. Good to know. And what about exercise? That seems to come up for everything. Does it help with PMS too?
It really does seem to. Regular physical activity is great because it helps your body release endorphins.
Nature's mood boosters, right?
Exactly. They can lift your mood, act as natural pain relief, which can definitely take the edge off anxiety. Even something gentle counts.
So you don't have to run a marathon. Maybe just a walk or some stretching.
Absolutely. Just incorporating a bit more movement during those pre-period days could make a noticeable difference for some people.
Okay, that's encouraging.
And then, alongside diet and exercise, stress management is really crucial.
Makes sense. Stress makes everything worse.
Totally. So things like practicing deep breathing exercises, trying mindfulness or meditation, maybe some gentle yoga.
Things to calm the nervous system.
Precisely. And don't underestimate just getting enough good quality sleep. That's foundational for managing anxiety and irritability.
Right, all really practical things people can try. Now, the article also touched on some natural supplements specifically for PMS relief. What were those?
Yeah, there are a few commonly explored ones. Vitamins B6 and E come up often.
Okay.
Fish oil for the omega-3s. And also some herbal options called phytoestrogens.
Phytoestrogens, plant estrogens.
Sort of. They're compounds in plants that can have a mild estrogen-like effect in the body. But, with any supplements, it's always smart to chat with a doctor or healthcare professional first.
Good advice. Make sure it's right for you. Check interactions, that kind of thing.
Exactly. Find out what makes sense for your individual situation.
Okay, so pulling all this together, What are the main takeaways, the big messages we want people to leave with?
I think the core message is really one of empowerment, actually. Managing PMS symptoms is possible for many people.
It's not just something you have to suffer through.
Right. By focusing on healthy habits, nutrition, movement, stress relief, and maybe considering some targeted supplements if appropriate,
Yeah.
you can really influence how you feel during that pre-period time.
So it's about being proactive, understanding your body, and maybe seeing it as a time to practice some focused self-care.
I like that framing. Yeah, embracing it as an opportunity for self-care with hopefully a bit more ease.
Okay.
So, wrapping up this deep dive, we've seen PMS is real, it's complex, but it's getting more recognition, which is good.
Definitely.
It's tied closely to those hormone shifts. But other things play a role too. And encouragingly, there are lots of strategies, lifestyle tweaks, supplements that can genuinely help manage symptoms.
So hopefully you listening now have a clearer picture, drawing from both the market trends and the expert info we discussed.
Yeah. And maybe now, as you think about all this, consider which of these strategies might resonate most with your experience.
Like a little self-reflection.
Exactly. Could just one small dietary change, or maybe adding 5 minutes of deep breathing to your day, would that make a difference for you? It might be worth exploring further, maybe looking up more resources, or, like we said, talking to a healthcare professional to find the approach that's truly personalized for you.
Definitely something worth thinking about, finding what works for you.
Thank you to our two hosts for their insightful discussion. That wraps up this episode of our Knowledge series. If you have any thoughts on today's topic or want to explore more about the health supplement market and product trends, feel free to visit our info hub or reach out to us directly through our website. And if you're looking for ODM or OEM collaboration, we warmly invite you to partner with us to create impactful next-generation wellness products. Thank you for tuning in. We look forward to connecting with you again next time.